Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life. Achilles Tendinitis. Most of the people, they suffer from this condition. But unfortunately, most of the people, they don't know that they are suffering from this problem. What is Achilles Tendinitis? How to identify it? If you have this problem, then what are the symptoms that you experience? What are the risk factors? What are the home remedies? What is the Ayurvedic treatment plan? Let us know all these things. What is Achilles Tendinitis? How can we define this condition? Achilles Tendinitis is an inflammation and degeneration of the Achilles tendon. It is the inflammation as well as it is the degeneration of the Achilles tendon. Then, what is this Achilles tendon? The Achilles tendon connects the calf muscles to the heel bone. You have a muscle in your calf, right? This calf muscle is connected to the heel bone with the help of Achilles tendon. If it is inflamed, then this will lead to Achilles tendinitis. Treatment includes Ayurvedic Panchakarma, the purification regimen, and person-specific traditional Ayurvedic drugs. These are prescribed basing on your constitution and pulse examination. Okay, then let us know the causes. Ayurveda emphasizes on this Sankshiptah Kriyayogo Nidanasya cha Varjanam, in the sense, try to find out the cause and minimize it, if possible avoid it. Then this is the treatment. The Achilles tendon can become irritated for several reasons, including increasing your speed or running long distances too quickly. This is the important cause. If you increase your speed while jogging, or if you run long distances suddenly, then there is a possibility of Achilles tendinitis. Another cause, suddenly adding strenuous hills or stair climbing to your exercise routine. Another cause, doing too much too soon after taking time away from exercising. This is the most important cause. For example, you have been exercising since long time. Suddenly you have stopped the exercise. Then again you have started the exercise. This exercise, after taking long gap, if you do too much or intentionally or very intense exercise, then you may have this Achilles tendinitis. Another cause, a sudden or violent contraction of the calf muscles, such as during an all-out sprint, can cause Achilles tendinitis. Another cause, running too much and overuse. If you run too much or if you overuse your calf muscle, then there is a possibility of Achilles tendinitis. And another cause, lack of flexibility of the calf muscles. Actually, your calf muscles should flex. If there is a lack or if these muscles are deficient in flexibility, then there is a possibility of Achilles tendinitis. Now, let us know the risk factors. A risk factor is something that increases your chance of getting a disease or condition. Improper or badly worn footwear is the risk. Improper warm-up for your activity is another risk. in the sense, for every activity, for every exercise, you should warm up properly. If you don't warm up properly, if it is improper, then this will lead to Achilles tendinitis, and this is a risk. Another risk, inflexibility of the calf muscles. Actually, there should be good flexion in the calf muscles. If it is lacking, then this will lead to Achilles tendinitis, and this is a risk. Another risk, improper cool down. Actually, after every exercise, after activity, you should cool down. In the sense, you have to cool yourself. Improper cooling and improper cool down can cause Achilles tendinitis, and this is a risk. And an improper training program is another risk. Actually, for every activity, you should take proper training. If you don't take proper training, then that will lead to Achilles tendinitis. If you feed rot, you will get rot as printout. Okay, then let us know the symptoms. Symptoms of Achilles tendinitis may include 1. Tenderness, usually located 1 to 2 inches above the point where the Achilles tendon attaches to the heel bone. It is noticeable in the morning upon rising. Another symptom, stiffness that gradually eases as the tendon is warmed up. Another symptom, pain after activity that gradually worsens. Another symptom, radiating or localized pain along the tendon during and after running. If you press hard, then that will ache. Another symptom, swelling in the area of Achilles. Okay, then how to diagnose this condition? Let us know. You are asked about your symptoms and exercise habits, and a physical exam will be performed. Tests may include X-rays to see if there is calcium in the tendon, MRI scan to view areas of interior damage to the tendon. There are excellent home remedies for this condition. Let us know one by one. First home remedy, make a poultice of ground fenugreek seeds, also known as methi dana, and use on the affected part. Another home remedy, heat the leaves of the calotropis plant, also known as fallowort in English and aak in Hindi, and tie them over the affected part. Another good remedy, 2 to 3 teaspoons of pepper powder is fried in 2 teaspoons of sesame oil, also known as til ka tel, until charred, until black. When it is warm, it is applied on the affected areas and massaged lightly. Another good remedy, a 3-inch piece of dried ginger is ground with a small piece of asafoetida, also known as hing, in the milk. This paste is applied on the affected area. Another excellent home remedy, combine 6 teaspoons each of ginger, also known as adrak, and caraway seeds, also known as shajira, along with 3 teaspoons of black pepper, also known as kali mirch, and grind into a fine powder. Have 1 teaspoon with water twice daily. Another good remedy, eat 1 to 2 garlic cloves, also known as lasan, as first thing in the morning. Another excellent remedy, apply clove oil directly on the affected parts. Another good remedy, take 1 gram of wheat flour and add half of its quantity of turmeric powder. Also add linseed oil to it and make a paste. It will become like a poultice. Apply it on the affected part. This poultice will enhance the blood circulation, and within 2 days you will get the relief. Another excellent remedy, warm the papaya leaf over the fire and apply on the affected parts. In the same way, another good remedy, Heat ginger, also known as adrak paste, with turmeric, also known as haldi paste, in 1:1 ratio and apply. Another excellent remedy. Soak 2 teaspoons of licorice root, also known as mulati, in 1 cup water and leave overnight. Mix into the infusion 1 cup rice gruel, also known as cooked broken rice, and take every morning. Another good remedy. Grind a turmeric paste and mix in a hot water to form a thick paste. Apply this paste over the affected part. Soon the pain will vanish. Another remedy. Prepare the oil of turmeric by boiling turmeric paste in sesame oil and lightly massage with this oil. In the same way, another good remedy. Mix turmeric powder in the milky exudate of calotropis plant, also known as ark in Hindi or arka in Sanskrit, and apply over the affected part. This paste will quickly give relief. In the same way, another good remedy. Mix equal quantities of castor oil and lemon juice. You will get a liniment. Massage the affected area with this liniment. Now let us know the treatment plan. Rest. This is the best treatment. Take a break from the activity that caused the tendinitis. Switch to an activity such as swimming that does not put stress on the tendon. Orthosis. This is another modality. You may be advised to wear a shoe insert that will place your foot in the correct position for walking and running. Another modality, Ayurvedic physical therapy. This includes stretching, this includes massage and panchakarma, and this includes strengthening specific exercises. And another modality, medications. Anti-inflammatory herbal drugs to ease the pain and decrease inflammation are suggested. This must be combined with other treatments. And last but not the least, prevention. To decrease your chances of getting Achilles tendinitis, you should follow certain guidelines. Take the time to warm up and cool down properly. Wear appropriate footwear for your sport. Another important thing, do not use shoes beyond the recommended duration. This will depend on how frequently you exercise, the surface on which you exercise, the conditions in which you exercise. And another important thing, gradually add hill work, stairs, speed and distance to your exercise routine. Another important thing, stretch and strengthen the calf muscles regularly. So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.